Good afternoon. It is a pleasure to be here and present on this most important topic of maternal and infant health. Pregnancy is a unique period during a woman's life and is characterized by complex physiological changes which may adversely affect oral health. At the same time, oral health is key to overall health and well-being. Preventive, diagnostic, and restorative dental treatment is safe throughout pregnancy and is effective in improving and maintaining oral health. However, health professionals often do not provide oral health care to pregnant women. At the same time, pregnant women, including some with obvious signs of oral disease, often do not seek or receive care. And in many cases, neither pregnant women nor health professionals understand that oral health care is an important component of a healthy pregnancy. So, what facts do we know about pregnant women and oral health? 60% of pregnant women have tooth decay or gum disease. Poor oral health can lead to poor health outcomes for both the mother and baby. Pregnancy can make a woman more prone to periodontal or gum disease and cavities. More than 75% of obstetricians and gynecologists surveyed had patients who reported being declined dental services during pregnancy. And importantly, dental care during pregnancy is safe and effective. For these reasons, a national consensus statement was developed to respond to the need for improvements in the provision of oral health services to women during pregnancy. The consensus statement outlines that it is essential for health professionals, physicians, nurses, midwives, nurse practitioners, physician assistants, dentists, dental hygienists, community health workers, and home visitors, to name a few, to provide pregnant women with appropriate and timely oral health care, which also includes oral health education. The guidance was developed to help health professionals, program administrators and staff, policymakers, advocates, and other stakeholders respond to the need for improvements in the provision of oral health services to women during pregnancy. The consensus statement and recommendations came out of the expert work group meeting convened by the Health Resources and Services Administration's Maternal and Child Health Bureau, in collaboration with the American College of Obstetricians and Gynecologists and the American Dental Association. The content from this meeting may be found at the following URL at the bottom of the page. As you know, oral health impacts overall health. Poor oral health can damage far more than just one smile. For example, the oral cavity is the gateway to the body for all that we eat and drink. It affects our ability to taste and smell, to feel and touch, to show feelings and emotions, and to speak and communicate. Oral health also affects overall health and contributes to other diseases such as those as identified on this slide. For example, it includes glaucoma, dementia, and migraines, respiratory diseases, cardiovascular disease, acid reflux and diabetes, kidney disease, rheumatoid arthritis, and also preterm and low birth weight babies. So what can be done and what are the recommendations? Prenatal care health professionals may be the first line in assessing pregnant women's oral health and can provide referrals to oral health professionals and reinforce preventive messages. Assess pregnant women's oral health status during the initial prenatal evaluation by taking an oral health history. Following are examples of questions that prenatal care health professionals may ask pregnant women. This information may be gathered through a conversation or a questionnaire. Do you have swollen or bleeding gums? Do you have a toothache, problems eating or chewing food, or other problems in your mouth? Since becoming pregnant, have you been vomiting? If so, how often? Do you have any questions or concerns about getting oral health care while you are pregnant? When was your last dental visit? Do you need help finding a dentist? And if possible, check the mouth for problems such as swollen or bleeding gums, untreated tooth decay, mucosal lesions, sign of infection or trauma, and be sure to document your findings in the woman's record. Another recommendation is to advise pregnant women about oral health care, including encouraging women to seek oral health while pregnant, reassuring them that oral health care is safe throughout pregnancy, including use of radiographs, those are x-rays, pain medication, and local anesthesia. And if urgent care is needed, writing and facilitating a formal referral to a dentist who maintains a collaborative relationship with you is helpful for a warm handoff. Another recommendation is to advise pregnant women about good oral hygiene practices. And what are those? That's brushing twice daily with a fluoridated toothpaste, flossing once daily, choosing healthy foods, limiting sugary foods and drinks, drinking water between meals, rinsing the mouth with fluoridated water after vomiting, and taking prenatal vitamins. It is also helpful to work in collaboration with oral health professionals by establishing relationships with the professionals in your local community, developing a formal referral process whereby the oral health professional agrees to see the referred individual in a timely manner and to provide subsequent care, and share pertinent information about the pregnant woman with the oral health professional and coordinate care as appropriate. Other recommendations that are helpful for pregnant women are providing support and improve health services, understanding insurance coverage issues. For example, in Arizona, there is no coverage for preventive or restorative procedures for Medicaid pregnant women over the age of 20. Understanding how dental care is accessed through IHS, that's Indian Health Services. And also, most private dental insurance covers only part of the restorative component of care. Other recommendations that are helpful for pregnant women are providing support and improving health services. So incorporating oral health on the medical history intake form, establishing partnerships with community-based programs, such as home visiting programs, WIC, Early Head Start, First Things First programs, providing referral to a nutritional professional if necessary, integrating oral health topics into prenatal classes, including breastfeeding classes, and provide culturally and linguistically appropriate care. With these recommendations, improvements can be made in oral health systems of care and ultimately improving maternal and infant health outcomes. Thank you.